you for this lecture by Theda Skocpol, who we usually say this, but in new school this is really true. She doesn't really need introduction here. In lots of our classes, for many years now, we've been, for lots of our classes for many years now, we've been using states and social revolutions. And at least as far as I know, the sociology students here, and there's a good number of them, have all studied it and read that. I'm not so sure that he had worked sufficiently with the kind of work that she did afterwards. I mean, now we can say, hindsight is 2020, we should have been more focused on her work on the early American welfare state, the way social policy has developed this country. There are several writings on healthcare. I'm not going to mention the titles, because she has so many of them, but they are all extremely interesting and, I should say today, important works for us now to understand the situation that we're in. Undoubtedly, she's going to be writing about this too, because the Obamacare book, as good as it was, is only now, for retrospect, perhaps an episode which we still don't know in what direction it's going to be changed, transformed. But in any case, she's going to be, pretty sure, writing about it. So she is, let me get your formal title. She's Victor S. Thomas Professor of Government and Sociology at Harvard. She's been Dean of the Graduate School of Arts and Sciences, President of the Social Science History Association, all the rest of these things. She's one of the top sociologists in the United States. I think many of us would agree with that. And so it's a great pleasure to have you there.
Well, thank you very much. Let's talk a little bit about the politics of health insurance in the present moment with some flashbacks. But let me just say that my remarks today, and I welcome this getting to these broader issues in the discussion, draw on the work that I've done, not just on the social policies, the social insurance and welfare policies that pass in the United States, don't pass in the United States, and the politics of those battles, but also my current work is on the U.S. right. And actually, that's where all the action has been for a while, and that's certainly where the action is now. And, I some years ago, early in the Obama administration, Vanessa Williamson, who's now at Brookings, and I did the work for a book called The Tea Party and the Remaking of Republican Conservatism. And I definitely remember the Tea Party, grassroots Tea Party people that we interviewed, telling us how much they hated Obamacare because they saw it as taking from deserving Americans to give to the undeserving. And the undeserving were the young, low-income and minority people and immigrants. And you could not convince them, not that we tried, we just listened, but you would not have been able to convince the Tea Party people we interviewed around the country that immigrants were not big beneficiaries of this redistributive and equality-enhancing social insurance program. And that sentiment has obviously fed into the present moment in the rise of Donald Trump. So let me just remind us about the enactment of what actually, in retrospect or in a serious analysis, is one of the most equality-enhancing government programs passed in the United States for 50 years. And I know that a lot of people on the left don't believe that. But if you get right down to it, this was a law that taxed the well-to-do and businesses to squeeze out enough resources to try to make health insurance coverage through public or private programs more affordable for the low-income, largely working families that had been left out of health insurance in the United States by the early 21st century. Here are the major things that the Affordable Care Act, signed into law in March of 2010, does. It creates new rules of the game for insurance companies. Those new rules are pretty important because they say that insurance companies can still try to make profits by selling health insurance to employers and to individuals, but that they must do it not by excluding people with illnesses, pre-existing conditions, or who becomes sick in expensive ways, and not by charging differential premiums at the extreme between young and old, men and women, but by finding ways to somehow innovate within a sort of regulated market. It also makes insurance basically more affordable, not completely affordable for most Americans, by expanding Medicaid, the long-standing state-administered, federally subsidized health insurance program for the poor, to the near poor, and by creating subsidies for small businesses and lower middle income individuals to buy private plans on marketplaces called exchanges. Each state, either of its own accord or because the federal government sets it up, has this kind of marketplace, basically a virtual marketplace where you're supposed to be able to compare private insurance plans and also find out whether you're eligible for federal subsidies to help you afford the premiums. And then there were some other things in the law, like improvements in basic Medicare coverage for the elderly. Medicare is for the elderly. And letting young people stay on their parents' insurance plans if their parents happen to have them. So those are all of the basic things in the law. Now, the law passed, was signed into law, barely squeaking through Congress by a partisan vote in March of 2010. Then it was tied up for 2 years in litigation, mounted by 26 Republican-controlled states. Maybe there was one Democratic-controlled state in there, but it was mainly Republicans, until the Supreme Court, in a hair-thin decision, June 28, 2012, upheld most of the law, but also made it optional for states to decide whether they would accept the federal money to expand Medicaid to the near poor, thereby setting in motion yet another round of partisan fighting over whether each state would take the federal money to cover near poor people. It was assumed in the original law that a state that didn't take that money would lose all of its Medicaid money. That's a sort of offer you can't refuse. The Supreme Court turned it into an offer the states could refuse. And I'll come back to that later. The next step in locking in the law, and I believe I'm going to argue by the end of this lecture that it is to some degree locked in. I don't believe it can be completely scrapped. Was the re-election of Barack Obama in 2012. Now, here we are in 2016 and 17 with the anti-Obama in the White House. I think in many ways the way to understand Donald Trump is as someone devoted to erasing Barack Obama and his legacy from American politics and policy. And he's been saying all along it's got to go, he's going to repeal and supposedly replace it with something terrific. So the partisan landscape has turned 180 degrees because Trump and Republicans devoted to repeal control all of Washington and are on the verge of appointing people to the Supreme Court. So very broadly, not just Obamacare itself and its future, but all of U.S. health insurance is at the heart of the politics of inequality at this moment. Obviously, what happens to immigrants in the United States is too, but if we're talking about economic consequences for large swaths of America, I would say this one is the big one that's at stake, in part because it's not just Obamacare that's up for grabs now, but a radicalized Republican Party in control in Washington, led by people who would like to make fundamental changes to the pre-existing public health insurance programs, would like to radically cut back on Medicaid spending for the poor and the elderly and the disabled. Medicaid, which even before Obamacare reached about half of all American families in one way or another, because it's a big payer for care for the elderly and disabled as well as the very poor, and would like, if they got their heart's desire, to transform the Medicare universal health insurance program for the elderly into something more like Obamacare, where the elderly are given a voucher and told go shop for health insurance. And that doesn't work too well when you're older and you actually need health care. So that's the dream of Republicans right now, to do all of those things. And that would just have tremendous consequences for economic and social inequalities in the United States, and would fundamentally transform the relationship of government to virtually all citizens. Now, what I'm going to do here is look back briefly at what the Affordable Care Act has accomplished since 2010, especially since 2014, when it was fully implemented, started to be, and then talk a little bit about these Trump and GOP plans for these huge reversals in all of Americans' health insurance programs, and then I'll talk about the politics. Why the Republicans, even though they formally control the levers in Washington, face real obstacles in carrying through this sweeping program. And then finally I'll get to the Democrats, who have been feeble in the extreme in their political defense of Obamacare, but are waking up now, and the question is, how are they waking up, and will it make a difference? So that's where we're headed. Now, I know many people here are from other countries. Let me just say briefly what the U.S. health insurance system in particular was like before 2010. It was very expensive. It had growing numbers of Americans without any health insurance. Now, many people who were employed at relatively large employers get health insurance through tax-subsidized coverage from their employers. The very, very poor got it from Medicaid after 1965, and the elderly from Medicare after 1965. But millions of Americans were left out of this mixed and incomplete system, and their numbers were growing by about 1 million a year leading into 2010. And, you know, we can ask, is insurance the only issue in healthcare? No, of course it is not. American healthcare delivery is skewed toward expensive procedures in hospitals and acute care, that is, the care of people who are already very sick or suffer from severe conditions that can be treated by surgeons and other highly expensive physicians. But we do know that lack of insurance coverage makes it harder to get access to adequate care, mainly because even though it's not legal, hospitals try to avoid admitting such people. They shunt them around. And such people also, out of fear of getting bills for uncompensated care, just put off their care. So people are sicker and they die at larger numbers if they don't have health insurance. It's also true that the primary cause of family bankruptcy before 2010 was medical bills that families tried to cover and could not. So the U.S. system was extraordinarily expensive compared to the rest of the world. That's a quick look at that. And here's what it looked like in 2009. About half of under 65-year-olds covered by employer insurance, 17% uninsured, another 17% covered by the prior Medicaid program, and some by Medicare. Most of the uninsured leading into the Obama presidency were, this is the percent of the poverty line. They were people who were under the poverty line or just above it, and mostly adults and children in families with at least one employed worker. That's because small businesses, and this was increasingly so in the years leading into 2010, could not afford to provide the coverage through the employer system and weren't providing it. Very uneven across the states. You can see that the light blue is where the rates of uninsured were the highest, and it's of course the South, the usual suspects, but also out west and in some of the most wealthiest states as well. Intermediate would be throughout the Midwest. The lowest levels of non-insurance, states with the highest insured populations, included, by the way, Massachusetts, my state, which had Obamacare before Obamacare because it was Romney care. It was put in place under Governor Romney, a Republican. Now, once the Affordable Care Act was passed, it aimed to go after that uninsured chunk, which was 17% in another chart and 18% in this one, both from Kaiser. I'm not sure why they're different, but whatever that chunk is, it was going to provide about half of the uninsured with coverage by expanding Medicaid to the near poor, originally in all of the states, that was the idea, and by providing subsidies for people above that income level, lower income people and middle class people, really, to afford private plans on the health insurance exchanges. Now, if we look back, this law, imperfectly implemented as it has been since 2014 when the provisions went into full effect for the subsidies and for the expansion of Medicaid, is an extraordinary success. You don't see this kind of impact of a government program. Here we go. Look at that, the plunge in the uninsurance rate. In any kind of objective world, people would be cheering for this kind of accomplishment and saying, how can we improve this? But I think, as many of you in the room may know, the Republican Party and the right in this country has not accepted in any way that this law is successful, and the left has largely not accepted. I know I'll get a run out of New York for saying this, but I'm going to say it. The left has been naysaying about this law from the beginning because it attempted to work with private insurers and regulate them, rather than simply doing something that I think a lot of people imagine politics can do, which is throw in all the old Scrabble pieces and pick up a whole set of new ones. That happens in Scrabble. It doesn't happen in politics. And whenever anybody has proposed to create a Canadian-style system in which government collects taxes and pays to insure everybody, it has failed on the ballot in the United States. And that's because, not because single payer wouldn't be efficient and just in a world where it was Scrabble and you could start all over, but because politics starts from where it is, and lots of people have a vested interest in the way it already works in the United States. That's why the Affordable Care Act tried to ooch the existing system in the direction of universal coverage, or closer to universal coverage, rather than scrapping or trying to substitute for the existing system. Now, I want to just highlight something that I am going to come back to later because it's crucial for the politics going forward. After the Supreme Court made it optional for states to decide whether they would expand Medicaid coverage with dollars from the federal government under the Affordable Care Act, a regional and partisan pattern developed as some states, the ones in blue, adopted the Medicaid expansion either immediately or over time between 2012 and 2016, and others, the ones in orange, refused to take the money to cover their near poor people. And you can see that the pattern is largely what you might expect, with Texas and that middle tier of states and the deep south saying no. But Wisconsin under Governor Walker said no, and Maine under Governor LePage failed to do it when the legislature came within one vote of overriding him and failed. So that pattern we'll come back to because it's really very important now Many of those states, including those core states in the Midwest that went for Trump in this election, their governors, Republican governors, adopted the Medicaid expansion, which means that hundreds of thousands of near poor people have been added into health insurance in those states, above and beyond those who buy plans on the private exchanges with tax credits. So the uninsured rate has dropped we saw dramatically how much it has dropped, but it's a very different picture in the non-expansion states versus the expansion states. The expansion states are the states that sooner or later adopted the Medicaid expansion, and you can see that by 2015 their uninsurance rate is much lower than the ones that held out, the orange ones on that map. Now, I just want to flag one more issue. As this law was fully implemented, the rate of health insurance inflation compared to general price inflation actually slowed. That was true through 2015 and 16. It began to tick up again in 2017. Americans heard about this just before the election in November, that many insurance companies, in announcing their plans for the state exchanges in 2017, were raising their premium prices, which in that general map that I just showed would tick things up a little bit. But it's not as if health insurance inflation started with the Affordable Care Act. And in fact, the Affordable Care Act was bringing down the rate. That's not to say that it was bringing it down for individual families. And in fact, what happened, especially as premiums went up, but also as insurers and employers adjusted to the new system after 2014, many of them shifted costs on to individual employees and families, requiring somewhat higher deductibles for people to pay before they could get access to their insurance. So the overall story from the point of view of individual Americans in the low and middle income ranks was that access to insurance plans that were pretty good got a lot better over the course of the early years of the implementation of this plan, but people are still feeling that they often have to pay fairly high deductibles or co-pays when they go to the doctor or the hospital. In fact, my employer, Harvard University, took the occasion of Obamacare to do what it had been wanting to do for a long time, which was to impose higher co-pays on everybody. I want to mention that even though in many ways the Affordable Care Act, despite uneven implementation, achieved remarkable gains in insurance coverage while keeping overall costs down, the public never embraced the law. It never embraced it or rejected it much more than it was from the very first moment. It was a pretty even division when it passed in 2010, and with some ups and downs, it's back to where it always was by now, which is very divided. This is the public's reaction to the question, do you approve or disapprove of the Affordable Care Act or Obamacare? It's actually more people disapprove if it's called Obamacare, or they did before Trump was elected. They've changed their minds now. But it's very different from the pattern of public opinion about the parts of the law. This is a 2013 poll, but this kind of poll has been reproduced many times. When you ask people about the various things that are in the law, the new insurance rules, the subsidies to make insurance affordable, the expansion of Medicaid for the poor, those all have much higher approval levels, almost all, except for the rule that individuals have to buy insurance. All of them have high bipartisan approval, but a lot of people never learned that they were in the law. And I will come back to that at the end of my remarks when I talk about the failure of the Democratic Party in the politics of the Affordable Care Act. Now, let's get to what happens now. Here's our buddy Donald Trump telling us it's going to be terrific as he destroys this law. And his words are not just empty, because he comes to office with a radicalized Republican Party controlling 2 houses of Congress by substantial margins, especially the House. The man on the left there is the new Secretary of Health and Human Services, Representative Price from Georgia, who has long wanted to basically destroy the federal government's commitment to the funding of Medicaid, Medicare, and the Affordable Care Act. Paul Ryan is the man there signing a repeal bill that the Republicans passed in 2016 that Barack Obama vetoed. And he is, of course, from Wisconsin, the Speaker of the House of Representatives, and before that he was the budget chair in the House of Representatives. His plans for some years have been backed by especially House Republicans, calling for major cuts to Medicare, ideally by turning it into a voucher system where elderly people have to pay more and more out of pocket for their health insurance. Major cuts to Medicaid, the prior program, not just the one we have now, which take the form of something called block granting. What block granting means is that the federal government would no longer guarantee Medicaid coverage to people who are eligible for it because they're poor or become poor in an economic downturn, but would simply hand the states an annual appropriation and let them spend that money as they like. The whole point of block granting in the Ryan plan and all Republican plans is to reduce the federal government's commitment going forward to pay for Medicaid for the disabled and the poor, and to allow governors, particularly in Republican states, to shift the resources around, probably to provide more coverage for the middle-income elderly and less for the minority poor in their states. The overall Ryan budget that has passed again and again and represents a sort of wish list for Republicans. This is a Mother Jones graphic, so it's partisan, but I think it's true. If they got what they wanted, the Republican dream, would make all those changes to health insurance, repeal Obamacare, and do a whole series of draconian cuts in food stamps, education spending, early childhood and education programs, you name it. All of this in order to provide massive tax cuts tilted toward the wealthy and corporations in this country. Now, that's the dream. And, I think it's important to realize that there are 2 dreams converging here. One is the Donald Trump dream to erase Obama and his legacy. And for him, I think repealing Obamacare is that kind of statement. He may not know what's in Obamacare. My guess is that Donald Trump does not understand that Obamacare taxes people in California, well-to-do people in California, New York, and Massachusetts to pay for health care in the states and communities that voted for him disproportionately. I don't think he gets that. It is a massive redistributive program, not just across class lines and ethnic lines, but also across geographical lines in which the liberal states are actually paying disproportionately for the health care of conservative states. But I think the Republican radicals, led by Paul Ryan, Tom Price, and others, are coming at this from another angle. They're the other prong of the radicalization of the Republican Party in the Obama period. Trump represents the resentment of immigrants, the expression that's in many ways symbolic, that his supporters fear the changing social composition of the country and are willing to cut off their own economic noses at times to express that fear and anger about other people getting something from the federal government. On the other hand, the other prong of the radicalization of the Republican Party is the Koch agenda, which my research group is also working on. And that is an ultra-free market agenda that sees government as something that should be cut way back as a regulator of the economy, as a taxer and spender, out of libertarian and free market principles. The Kochs and their 500 millionaires and billionaires who fund an interlocked set of political organizations that have helped to pull the Republican Party toward the far right economically do not really care that much about immigrants one way or another. They will adapt to what they need to adapt to on issues like the Christian right priority of getting rid of abortion, the NRA, National Rifle Association priority of protecting gun ownership, actually maximizing gun ownership, or the anti-immigrant agenda, reluctantly. They will adapt to that. If that's the price of getting enough votes to elect Republicans who can carry through the core agenda from their perspective, which is to eliminate government regulation in the economy, for the environment, cut taxes on the wealthy and businesses, and wean Americans, that's certainly how they see it, from any kind of involvement with generous social spending for health care and other social programs. From their perspective, health insurance provided through government subsidies or direct taxation is immoral. And it is important to recognize that that is how these wealthy people actually see the world, because they have faith, the faith of the true believer, that if Americans are freed from these programs, that suddenly there will be a burst of self-reliance and innovation and opportunity for everyone. So that's the thrust of the GOP desire to privatize or eliminate public health insurance programs in Congress. And that's coming from a slightly different direction from the Trump desire to get rid of programs that are perceived as benefiting the wrong kinds of Americans. But of course, it doesn't really matter in the end if one thrust passes the legislation and the other one signs it. It'll happen. And it's typical in politics for different intentions to converge to produce big outcomes. And it is profoundly unpopular. And one of the ironies, I'll just state that when it comes to Medicare insurance for the elderly, one of the things that Vanessa Williamson and I found when we interviewed grassroots Tea Partiers back in 2011 is that they all supported Social Security and Medicare. I think there are a lot of analyses, including the otherwise fine work of Jane Mayer on the Koch network, that present the Tea Party at the grassroots and now Trump supporters at the grassroots as creatures of the Koch network. Well, that's just not true when it comes to things like Social Security, veterans benefits, and Medicare. The popular thrusts in these right-wing phenomena are interested in excluding immigrants and preventing racial and social change above all. They're not interested in getting rid of generous social insurance programs for real Americans. That is them. And so at the grassroots, when it comes to Medicare in particular, many of the people who voted for Donald Trump and before him declared themselves to be Tea Party Republicans really don't want the kinds of changes that Paul Ryan and his congressional colleagues want to push through at all. But even Obamacare, which I showed you was a source of great division and certainly was rejected by Tea Party Republicans and by many of the popular voters who voted for Trump in the Republican primaries and in the general election, it has become somewhat more acceptable since he was elected. Because as people start thinking about it, they begin to hear from their friends, relatives, and neighbors about the particular parts of it that are benefiting them. The Medicaid expansion, the subsidies for purchasing plans on the exchanges. And those particulars, which were always more popular if people were asked about them, become more salient. So just since the election, we've seen a shift away from sentiment, which was in the 30 to 40% range for repealing it altogether, and we're now down to only 1/5 of Americans wanting to just repeal the thing and think about replacing it for all later. Half don't want to repeal it, and another 28% and rising, including increasing numbers of Republicans, want to wait until they know what's going to replace Obamacare before it is removed. That dynamic has been underway and it's likely to increase. Furthermore, what ordinary people across the partisan spectrum really care about when they think about health reform is reforms to reduce the amount of money that individuals and families have to pay in out-of-pocket costs. They want costs reduced for them. That would take bigger subsidies than the subsidies that are in Obamacare, not lower ones. It would take a more generous programs of Medicare and Medicaid, not less generous. And there are a whole series of other things here that come into play. I'll skip that one because it's a little too complicated. Basically, there's a very big partisan split, although not quite as big as it was even before Trump was elected, between Republicans who are thinking in terms of limiting health spending through the federal government, which you have to understand for many of them also means limiting the taxes they pay, and independents and Democrats who see the next steps as guaranteeing a certain level of health coverage and more financial help for people. So that's the landscape on which this all-Republican, Trump-led juggernaut launches into what could be truly radical remakings, not just of Obamacare, but of all of public health insurance efforts. Furthermore, and this has just come out from the Economic Policy Institute, it's not just the loss of insurance coverage or putting it out of reach in terms of affordability or driving private insurance companies out of the Obamacare exchanges. The latest estimate on that is that 10% of the population would suddenly find themselves living in places with no plans offered on the health insurance exchanges should Obamacare be either repealed or bollocksed up through administrative action, which is more likely. It's also the case that a lot of job losses would follow. And I think this ought to be a matter of some common sense. If you cut, this is the estimate from the Economic Policy Institute, if by 2019 you cut federal spending by $109 billion, and you cut taxes by $70 billion, the effect is going to be, especially when you take into account the stratification of those impacts, is going to be to cut jobs across most states and localities. That's in part because the tax cuts would not be offset by the spending cuts, but also because the spending cuts will raise the costs of basic health care for low and middle income families, thereby reducing their income to spend on many other things, whereas the tax cuts will go to well-to-do people who have a tendency to save if they get more largesse through the tax system. And a lot of the jobs that would be lost are not just in healthcare. For me, I think about this very concretely. If you drive through the non-metropolitan parts of America, particularly the communities that had Trump-Pence signs all over them in the recent election, what you'll see in many of these communities is no storefronts in the downtown, a Walmart on the outskirts, the Walmart, by the way, using Obamacare to subsidize low wages for its employees, and you'll see a hospital in the county seats, where many of the best jobs are to be found and certainly vital health care is provided. If you take a lot of money out of the health insurance system for Medicare, Medicaid, and for Obamacare, many of those hospitals just outright close. And that doesn't even count the drug clinics dealing with the opioid crisis or the nursing homes dealing with the elderly population, which are disproportionately the residents in these older white areas. Pennsylvania alone, as I wrote about in the New York Times, would be devastated by the carrying through of these plans, particularly in the smaller cities, suburban counties, outer suburbs, and rural areas that voted for Donald Trump. Every state would lose jobs, and the EPI report has a nice estimate of which states would be the hardest hit based on their populations and those who are benefiting now from things like Obamacare subsidies, and you can see that a lot of swing states are on that list. This is their figure for the darker means more loss of health care or more loss of jobs. And it's very uneven, but there certainly are a lot of states in the Republican column that would be hard hit. Now this is back to that figure about the states that have expanded Medicaid under the Obamacare post-Supreme Court 2012 situation. And I want to talk about this because it's not just that a radicalized Trump administration and backed by Republicans faces wary, increasingly wary public opinion. Public opinion actually doesn't do politics. Shocking to say, but people have to vote. And a lot of those who are most wary don't vote and didn't vote in this last election. Furthermore, the Republican Party ignores public opinion. It just, they think, well, it'll change later, and they take for granted that they'll be able to spend at the last minute to discourage opposed voters and encourage those that will support them. And they've not been wrong about that. It's been true in the last couple of elections. On the other hand, the economic impact, if analysts understood it, and I'm not sure they do in the Congress or in the Trump administration, should give them pause. Because if you're promising to make America great again by reviving and expanding the economies of a whole series of non-big city areas, taking a huge amount of money and jobs out of healthcare is not the way to do that. But here's the third factor that really complicates things for Republicans, particularly in Congress. All of the action in the expansion of Medicaid with federal dollars since 2013 has been in Republican-controlled states. Republicans control about 2/3 of the states in the United States. So my research team has looked in great detail into the factors that explain what we call the Republican Civil War over Medicaid expansion. All of the Democratic-run states expanded Medicaid to the near poor right away after the law started to go into effect. So we can just forget them. We can forget California, New York, Massachusetts, Minnesota. They did it. But 32 states have expanded Medicaid. The last one, Louisiana, right after a Democratic governor was elected. Most of these states in blue here are actually run by Republicans, sometimes in the governor and the legislature. Michigan expanded Medicaid in that situation. Ohio, under Governor Kasich, expanded Medicaid in that situation, etc. Iowa. So those governors are now facing a situation where they could suddenly lose, not just squeeze their traditional Medicaid funding and get a little more control over it, but they could lose the outright subsidies in the billions of dollars that enable them to cover many more poor citizens. And those governors realize that people will notice if they suddenly lose health insurance. The principle in political science and social science, I think everybody here knows, is that people are much more likely to notice losses and react to them than they are to understand possible gains. And that's particularly true of the population that's been affected by Obamacare, many of whom never understood what they stood to gain, or even that they gained it because of Obamacare, since it was usually called something else when it was expanded in various states. But suddenly these Republican governors are facing the prospect of a very clear-cut political as well as economic crisis in their state. So they've certainly got hospital executives in their offices telling them, please don't let this happen. And they are pressuring Republicans in Congress. And of course, if you're going to fundamentally restructure Obamacare and Medicaid, what do you do about the fact that some states expanded Medicaid and have a generous program and others don't? How do you do that? So that's one of the big obstacles here. This is a graph from our article in the Journal of Health, Politics, Policy, and Law. And the red bars there, the checkered ones show governors endorsing the Medicaid expansion in public, and the red shows who passes it, and you can see that after 2013, the action is pretty much all in Republican states. We developed in this research quantitative measures of the forces pushing for Republicans to expand Medicaid in the states, gubernatorial endorsements, which you can see were very, very widespread, Chamber of Commerce endorsements. The business community, not surprisingly, in most of these states, thought that it would be good to get a lot of money from the federal government to pay for private health insurance and hospitals. And in our research, we developed a very sophisticated quantitative measure. We counted not just whether the state chamber was publicly endorsing Medicaid expansion, but whether it had a healthcare staffer who worked full-time on these issues, and whether it had healthcare businesses on its board. And we found that to be a powerful predictor of gubernatorial endorsements and expansion. At the same time, we also developed quantitative measures of powerful right-wing pro-free market forces across the states. Because in recent times, a new brand of Republican, not just business Republicans, has become powerful in American politics. The American Legislative Exchange Council, which urges state legislators who are members in all 50 states to some degree to oppose all forms of regulation, spending, and taxation, was a leader in opposing Obamacare's Medicaid expansion. The State Policy Network is a network of free market think tanks that churn out op-eds and studies, quote unquote, designed to prove that it's bad for your state to take a lot of money to care for the poor. And Americans for Prosperity, which is a huge quasi-political party that grew up from 2004 on, funded through the Koch network, is now present in 2/3 of the American states, and we find that when it has a director in a state able to mobilize grassroots activism, that's a predictor in statistical models of the failure of that state to expand Medicaid and states being willing to pass anti-union legislation. So these are very powerful forces fighting it out inside the Republican Party. And on the case of health insurance, they are at war with the business community in many states. Now, let me just conclude by talking about Democrats. Democrats, of course, are now not in a very good position. I mean, I think that's obvious. They don't come close to controlling the House of Representatives. They are in full control of less than 10 states. I think it is maybe down to 7 now. And face total Republican control in 2/3 of the states. And in the Senate, it's more closely divided, but most of the plans that Republicans have for cutting back on health insurance taxes and spending can be passed with 51 votes through the Senate of the United States. So the action among Democrats and among the various community and advocacy groups on the center left of the United States who want to preserve Obamacare and health insurance programs is very much a matter of figuring out ways to ally with business forces in some cases, or mobilizing grassroots activism. Now, that's beginning to happen. It's not just that public opinion is shifting in the states. We're seeing Democrats in many places not just turning out for big marches like the one after Inauguration Day, but organizing locally. And health insurance changes are one of the issues that many local Democratic and center-left groups are taking up because they have a resonance with ordinary people across the urban-rural, urban-non-urban line, big city, non-big city line. And there's all kinds of possibilities for messaging because you can tie it down to individual families that may be facing particular new deprivations. So that's the good news for what's happening now, but the question is it too late? Because it's against a backdrop since 2010 in which the Democratic Party as a whole simply dropped the ball entirely on the political defense of Obamacare and political mobilization around it. It provided enormous opportunities for state and local level organizing, but the coalition Healthcare for America Now that played a role in the enactment of Obamacare in 2010 was disbanded. Democrats in the post-1960s era in the United States tend to think of policy as self-executing politically. They think we'll bring in a bunch of economists, we'll design an ideal policy. If it delivers much of what it's supposed to, people will notice and they will like it. That's not how politics works. Politics works by giving people a sense of identity stake in something. The right understood that about Obamacare, and they mobilized with a series of lies, basically, about who was benefiting and who was paying. The left, meanwhile, spent a lot of time either saying nothing at all. That was characteristic in most of the elections, 2010, 2012, 2014, because the pollsters said if you mention it, it's going to remind people they don't like it or they don't know what it is. So they just didn't mention it in a lot of the states that were benefiting from it. Or if they were on the left, they spent a lot of time talking about how this wasn't good enough, that what we really needed was single payer. Needed to get the insurance companies out of health insurance. And in the case of state and local groups, I think they did mobilize in many cases, but were it was very complex, very divided, and didn't link up to any kind of political messaging led by the White House or led by national Democrats to explain what this law was about. And I think it's a real indictment of the Democratic Party that its Democratic president and a Democratic Congress provided the votes for this major piece of redistributive social legislation in 2010, and then they went silent and never offered an explanation to ordinary Americans around the country of what this law really was. And I've asked people many times, I'm a Democrat obviously, and I've asked, and people have answered in two ways. They said it was so complex we couldn't explain it. I don't know about that. Or we worried that the label was unpopular, so we just dropped it. I've had the experience repeatedly of speaking to community audiences with a lot of working class people in conservative areas. And I've gotten up there and described the three main things that are in Obamacare, the new insurance rules, the subsidies to help people afford it, and the marketplace. And people always say the same thing. Why hasn't anyone told us that that's what was in the law? Well, they didn't. And so the question is now, it's the 11th and a half hour. Is it too late? On the one hand, it might not be because people become aware of what they might lose. So the possibilities for mobilization and message are there. But it may be too late because the Republicans that are in control in Washington, particularly in Congress, are determined to take advantage of this moment to make sweeping changes that start with huge tax cuts for the rich, thereby creating a situation down the line in which they can say there's not enough money for Obamacare, Medicaid, or Medicare. So I'm going to stop there by saying that even if the concerns about the economic and public opinion impact take hold, and they might take hold with Trump, you never know, if he sees it on television, right? It does appear that the new Health and Human Services Secretary, Price, is going to follow a plan of quiet evisceration of the law. And a great deal can be done by administrative rule changes. For example, relaxing the rules that limit the premiums health insurance companies can offer, allowing them to charge the elderly, older people more, younger people less. That, on the one hand, may seem like a way to be more popular or allow low-end plans to be sold to people without regulating what they cover. But of course, it will ultimately hurt the people who voted for Donald Trump, disproportionately older, sicker, lower income white people. But that won't happen for a while, and it may be that the hope will be that they can get away with this and make the changes less visible or clear-cut down the line. So let me stop there by saying that I think these battles will be right at the heart of the battle between the forces in control in Washington now and both Democrats and other center-left groups that are trying to push back. It's very hard to tell how that politics will play out. On the one hand, it's a set of issues that really do solve the biggest problem that liberals face, which is that they're concentrated in big cities and need to be able to speak to issues that cut across big cities and smaller areas. On the other hand, the Democratic Party has not been present organizationally or as a series of messages on these issues, particularly Obamacare. And so it's hard to tell how quickly that kind of capability can be put together and whether it can be put together effectively in time for a turnaround in the 2017 and 2018 elections for legislatures and for governorships across the country. And I think that if those elections don't begin to change the tide, that a radicalized, Trumpified Republican Party is going to be in power for a very long time in this country. So let me stop.